Welcome back to the Home Health Nurse Mentor Series. I'm so glad you're here. If you're watching this, you already know that home health nursing is unlike any other setting. You just don't walk into a patient's room. You walk in literally into someone's life. And that means really trust isn't a bonus, it's a foundation. Today, we're going to talk about how to build trust with your patients and their families from the moment you step through that front door. You see, trust determines how well a patient is going to listen to your teaching, or even to follow the care plan, or even allow you into their home again. Without it, you're just another stranger in scrubs. With it, though, you become a partner in their health journey. I remember early in my career visiting a man with congestive heart failure. His wife was hesitant to let me in, but after taking just a few minutes to listen to her worries about her husband's medications and his swelling and her fear of him falling, I saw that her shoulders dropped a little bit, and at that moment, she began to listen. And that earned me weeks of cooperation and eventually better outcome for her husband. The first 5 minutes of every visit are where trust really starts. Here's what to focus on. First of all, you need to look neat and clean, calm and confident, even if you're nervous inside. Smile, use the patient's name, and make eye contact when it's, well, of course, appropriate. Knock and wait for permission to enter, and ask where they like to sit or set up. It's always nice to compliment something personal in the home, like a plant, a quilt, a pet, to show them that you really care. And you start by saying, "Hi, my name is Todd. I'm your nurse from whatever agency you're working at, and I'm here today to check your blood pressure, vital signs, temperature and all that." And then ask what's their biggest concern lately, and just listen without interrupting. Nod and validate that sounds like you're really listening. Trust isn't just built once, it's reinforced on every visit that you do. And it helps to maintain and grow that relationship. Keep your word. If you say you're going to follow up, call and bring supplies, just go ahead and do it. Even if it's bad news, honesty really earns trust. And then educate without lecturing. Use plain language, avoid overwhelming with too much information. Say something, "I'd like to show you an easier way to remember your insulin schedule. Would that help you today?" It's one way. Or involve the family, including caregivers, and educating them when possible. And of course, respect their role without assuming they know everything. And respect privacy. Ask before discussing sensitive information around others, and offer to step aside or speak privately. And own your mistakes. If you're late or something goes wrong, apologize sincerely. We're all human. Say, "I'm sorry I was delayed today. I know your time is very important." Sometimes, despite your best effort, a patient or a family member is going to be guarded or resistant. But here's a few tips to think about. Just remain calm. Don't take it personally. Acknowledge the emotion. It seems like you've had a really tough experience with healthcare. I'd like to help change that if you let me. Setting boundaries is important with compassion. I want to support you, but I also need to create a safe space to do that. And let's work together. Healthcare is a team effort with the patient and the family and you. Trust is earned moment by moment. As a home health nurse, you're not just delivering care, you're delivering reassurance, presence, partnership. Your kindness, consistency, and communication will be what patients remember most about you. And keep showing up, keep listening. You're doing more good than you realize. So thanks for watching. In the next video, we'll talk about clinical judgment on the go, how to make solid decisions when you're out in the field, and sometimes with no one to call on, So don't miss it. See you in the next one.